Hi, this is Dr. Zehr again, continuing the conversation about arthritis. If you saw the last video, I touched on a handful of different subjects actually, or a handful of different explanations about how arthritis is so badly misunderstood and consequently sometimes mishandled by other doctors as well as you, the patient yourself, just due to lack of information or lack of understanding. One of the things that I mentioned earlier had to do with the fact that we are often very much under the impression in our society that arthritis just has to do with age. Your body's full of arthritis, you're getting old, and so on. And I have patients come in often telling me that their doctor did take an x-ray of their neck and just simply said, yeah, you have arthritis. And then you got the typical prescription, or you're told to do over-the-counter anti-inflammatories or maybe physical therapy, if anything. Most of the time, though, people are under the impression they just have it. There's not much they can do about it. They tell me and Dr. Plemon here in the office, yep, I know there's nothing you can do about that, but I know you can't fix the arthritis, but, and it just kind of makes us cringe when we hear that. Well, here's one way I like to try to explain to people that that's just a misunderstanding. This x-ray right here has a lot of things going on with it, but I want you to understand first what we look at, and that this neck would be told by a medical doctor to a patient that they had arthritis in their lower neck. And they would be describing these two disc spaces down below where the disc space between the vertebrae are thinner than the ones above. Well, it's kind of a simple thing. I don't mean to be too snarky here, but it's kind of simple to say these three healthy looking discs are the same age as these two unhealthy looking discs. So it's not age. There's got to be a reason. At the very least, there's been some sort of injury to the area to cause this to occur. But I'll tell you, more frequently, it's dysfunction. There's problems even with just this x-ray in the function of this person's spine with the lack of the proper curve and so on, that simply puts more pressure on this part of the spine, therefore causing that disc to deteriorate or degenerate prematurely. This much more accurately is diagnosed as degenerative disc disease because it is more descriptive of what is actually going on. Let me say one more thing about this condition in general. These joints in the back, these are called the facet joints. These joints are the joints that are designed to bear weight. If for biomechanical reasons and improper biomechanical reasons, we end up putting that weight-bearing load on the discs, they are not designed for that. They are not designed to be the cushions of your spine. Therefore, over time, certainly, they will start to succumb under that pressure, and you're going to see this type of a result. Again, the bottom line being, it's not due to age. Time is a factor, but it's simply not a chronological age that condemns you to having arthritis for the rest of your life, and especially a condition of which cannot be cared for to slow down, possibly stop, and certainly help you manage that condition much, much better under chiropractic care, especially the kind of care that Dr. Plemon and I provide here at Zehr Chiropractic.